Do we have a magic pill to cure all disease? Absolutely not. And sadly, nobody has that right now, and hopefully that won't be the case forever. But what we do know is that if we can start to identify and remove the obstacles that are in the way of somebody's healing, that gives them the best chance to actually create and tap into their inner healing capability.
So I would like to know more, because you talk about functional medicine. So why is functional medicine an essential strategy for anyone dealing with autoimmune condition?
Well, if functional medicine is new to any of the listeners, I'll break it down briefly. It is a very systems-oriented approach, which means it's very tailored to the individual. And what we learn about more and more about autoimmunity and all the different types of autoimmune diseases is that it's so essential to make sure that you are treating the person who has the disease. We see that in the research. We see that in a lot of the clinical outcomes right now that are being presented, that we're getting the best results when we address the underlying trigger points. I call these blind spots, things that aren't always obvious on the surface, but the more we know about autoimmunity, the more we know it's a collection of all of these triggers, of all these blind spots that have been happening over time, almost like a perfect storm. And what I love about functional medicine and what really excites me day to day working with my patients is that we are able to almost be like detectives and start to look at the underlying imbalances as best as we can. Do we have a magic pill to cure all disease? Absolutely not. And sadly, nobody has that right now, and hopefully that won't be the case forever. But what we do know is that if we can start to identify and remove the obstacles that are in the way of somebody's healing, that gives them the best chance to actually create and tap into their inner healing capability. And so we work alongside with different specialists and different Western doctors. It's not an us versus them approach, which also what I love about functional medicine. It's very inclusive. And we need all hands on deck when it comes to chronic disease. And in some situations, just simple dietary changes is all it takes for somebody. But I don't say that lightly, because most of the times it's a lot more than that. And occasionally we do need to help somebody while they're on their medications. But functional medicine is going to allow us to get to the nuances of where these imbalances could be. And I'm sure we'll get into what some of those nuances are in a moment.
Yeah, thank you. And also, I like when you said we see as a person, and to see a person as a whole. I think it's a very different approach that I would say a newer approach also is a recent view, I believe, than seeing just the disease itself or the label. And I think, as you said, this can be complex, and to see as a person then can see all the several aspects of that person contributing for that particular autoimmune disease. Thank you. That's very good. And I like when you said we are not against the traditional medicine, and it's not us against them. And I think that's also very complementary. Is also bring everything together. Thank you. I like.
We're in a very interesting time in healthcare right now, where technology is changing ever so quickly, and we're gathering so much data, and we're learning how to apply that data. And it is time that we all come together. And that's also what I love about this. It's almost like it's a bridge of bringing some of the naturopathic side therapies along to the allopathic side, and really starting to connect with biochemistry and the language of science and common sense, most importantly, in terms of helping our patients start to heal. And, really, we see so many trigger points for autoimmunity. And this is, again, going to be a big part of what we talk about today. And some of these things just aren't being addressed when I have my patients come to me and they've been to their specialist, if they have Hashimoto's, thyroiditis, for example, or if they have Crohn's disease or colitis, or they have rheumatoid arthritis. They're focusing just on the area that's being affected primarily. We now have to take a step back, and we have to say, listen, Roberta, we have to start to understand that this is a complex presentation here that probably involves a number of different factors. So we're going to start to now talk about how diet impacts their body's biochemistry and how it impacts their immune system. And we're going to be able to measure that. We're going to start talking about nutrient deficiencies, and we're going to start to measure those. Each nutrient, and there's over 33 that we often measure in one panel, Each
Oh, wow.
nutrient has over 200 jobs per second in your body.
Wow.
That's one nutrient. Imagine if we have multiple deficiencies. And these are so critical. These are involved with inflammation control, with immune regulation, different types of processes and methylation processes, et cetera, et cetera. I won't bore you with the details. But we now have to start talking about these things. We have to talk about the complex system called the gut microbiome and why this is so important. This is why this is also a passion of mine, because to me, the digestive tract, known as the gut, is literally the gateway to all things in our body. It is where 70 to 80% of our neurotransmitters are formed. It is where roughly 82% of our immune system lives. And this is where we absorb the nutrients so they can be passed on into the cells. We can absorb it through our food so they can be passed on into our cells to elicit any one of those 200 functions I mentioned earlier. And so this is why we start to talk about and measure these areas. And these are just not being done in the standard workup right now.
Yeah, so I was going to ask you more about this gut because, I think it's now, I'm not sure if everyone, lay people, know how important is the microbiome. I think we hear about probiotics, but that's the extent, at least for me, that extent I know, okay, probiotics are important. But I think, can you talk a little bit more about the gut and the microbiome and how this really influence the immunity? You just mentioned that I think was 80%. You mentioned that the immune system is in the gut. So can you talk a little bit more about that? Because it's so important for our audience.
Let me put just a few things in perspective so we can understand the power of it. If you can imagine how many cells make up our human body, just imagine that for a moment. It's an astronomical number. Well, take that astronomical number and times it by 100. And that's literally how many cells are part of our microbiome. Okay, and these are a combination of bacteria, potentially different types of yeast, and even different types of other organisms, some parasites and so forth. And these are things that are all meant to be kept in check. But it's a fluid, dynamic being, and it's impacted rather quickly by our environment, by our diet, even by our thoughts. And these are things that are also driven through a lot of the research right now. It's been shown that a traumatic event can influence our microbiome in less than 24 hours. Wow. So imagine if somebody is living in a constant state of stress and how that could potentially impact us. But what's really fascinating is if you take all those organisms and you take think of all of our human genetic material. And again, I might be getting into the weeds here a little bit, but we have a lot of genetic.
You can get in there. I might ask more questions.
No problem. We have a lot of genetic material that makes up our genome. Well, again, take that number and times that by a significant margin or a multiplier, and that's how much we are outnumbered to our bacterial gut microbiome DNA is outnumbering our human DNA, our genome, and it's outnumbering that by sometimes upwards of a factor of 10 to 100 to 1, depending on the researcher you talk to. Wow. And so having that influencing the rest of our body is a very critical factor and a very critical piece of optimizing our health, whether it's an autoimmune condition or whether it's dealing with even something such as anxiety or depression. There's so many factors that stem from the gut, which is why, to me, it's such a big part of conversation in our practice. So
how do we know how is the condition of our microbiome? Would you have if it's, let's say, the number of bacteria or parasites, or it's too large, so would we see symptoms, or would we go directly to lab test, or would we do both?
Well, we do both. It's a combination, again, of logic and common sense, but sometimes we can't see what's going on just by our symptomology. And we really stress when you test, you don't guess. So we really do look at the data as much as we possibly can, because even if somebody presents to me and they don't have any gut issues, that doesn't mean their gut microbiome is okay. So a lot of times we have some pre-education processes in place to help educate our patients to say, look, these are the things and these are the reasons why we're going to be exploring some of these areas that don't necessarily equate to that skin condition you have necessarily. When you think about skin, you don't necessarily think about your gut bacteria or your gut yeast right away. So we do a lot of measurement. We leverage the power of very high performance laboratories, and again, all over many different places in the world. We will, whoever's doing the best technology, we will work with them on that and utilize their services to help our patients gather the proper insights. And this is what I meant earlier, is that the technology is changing. It's constantly evolving, and we're getting better and better at understanding what are the best labs out there. So that's really what our job is as board certified functional medicine practitioners, is to work and to constantly be in the know of where we can be providing the best services for our patients.
So, and in terms of symptoms, would someone would be like if you don't have autoimmune disease, let's suppose, but then you have a suspicion that something is not right, would you give us like some ideas of things that could be showing off that your microbiome is out of whack? Something.
Well, it could be simple as noticing that you're more fatigued lately, or that you're having some brain fog, or that you're even craving things like sugar and bread products that you don't normally crave. These are all signs that that your microbiome could be impacted. Of course, there are many other reasons for that too, but anytime you're noticing a subtlety and a change, whether it's your sleep or your mood or your cognition, these are all big things. Some people, it's not as obvious as having joint pain, such as like an arthritic finger or an arthritic joint in their body, or having change in their stool and their bowel movements. Those are very obvious reasons. Becoming gassy and bloated, these are very obvious reasons to look at the gut. But as I said, there are so many other reasons why the gut should be looked at that doesn't have anything to do with a digestive concern per se.
So talking about the gut, I have heard many times about leaky gut. Can you talk a little bit about what is it and what is the effect of that?
Yeah, and I always puts a smile on my face, because I've done many lectures in person too, and I had one rather large audience, and I'll never forget this moment. It was about 500 people in the audience, and I was talking about leaky gut, and I had somebody put their hand up and say, "Excuse me, doctor, I think I would know if I had leaky gut, because I would be seeing things come out on the floor, right?" I'm like, "Okay, let's discuss this a bit further." So it is.
I don't think a lot of people don't think they know what is leaky gut.
Well, I'm sure many of your listeners are quite learned already and are aware of what this is. But again, to state the obvious, it is not a leaky rectum. It is not where we are having problems holding in fecal matter. It's more of an internal situation, of a biochemical situation, where if you think of our gut cells, and not many of us have actually seen them in person under a microscope, but they actually look very much like a brick wall, where you've got bricks and then you've got the mortar, and then it's all stacked together very neatly, very tightly in order. And really what happens is where that mortar is in the brick wall, this is actually a microchannel. And these are called tight junctions. And again, I won't go into the weeds too much here, but these are very selective channels that allow particular sized particles like nutrients, right, to get into from the bowel into the bloodstream. And sometimes there's literally only one brick or one cell separating the bloodstream from your bowel. So it's so important to keep those cells tightly bound together. Now, what happens over time if we are on medications like NSAIDs, like different types of pain relievers, if we're taking antibiotics, if we're on statin medications or antidepressants? There's evidence that suggests that these, among things that we eat in our diet and things that are in our environment, that these are slowly going to erode and degrade the integrity of your cell function. And so they start to literally leak apart. Instead of being really bound tightly like this, they start to separate. And suddenly we have these big gaps. And much like if you took a sledgehammer to that brick wall and now you have a big hole in your brick wall, things are going to get through that shouldn't be getting through, that are undesirable. And this is in turn a big part of autoimmunity, because we see that this can create a very big downstream inflammatory response. And one of the biggest enemies of virtually all types of autoimmunity is an uncontrolled inflammatory response. And so we want to make sure that we're really paying attention to understanding, all right, let's get those barriers. We can assess this. There are ways of measuring this, and we are getting better at the tools that have been around for a while to do this. But we can get a sense of how those tight junctions are functioning. And that's what we start to do with our patients, and do a workup from that, establish, okay, well, we've got some leaky gut there. We've got to start to heal and seal that gut before really we do much further. And then once that is healed and sealed, we then have that foundation that we can build upon.
So it's like this tight junction is like a little wall protecting from, let's say, bacteria to go into the bloodstream. I'm just going to say bacteria just to make it easier. And so the nutrients should pass, but nothing else than the nutrients should pass. And if leaky gut means this wall becomes more permeable. And then what you don't want is also going to the bloodstream. Is it correct?
Correct, exactly. Because as we can all imagine, what comes out in terms of the stool is not something that's desirable. That's meant to be
Toxic, yeah, mainly toxic from the body, and that can cause more inflammation. And we all know the autoimmune disease is inflammation. I just say it is inflammation, but the cause can be different causes, and so leaky gut could be one of the causes as well.
It is it is definitely one of many areas that we look at, but it is such a fundamental place to establish at least a proper integrity as best as you can, and then we can build from that. And it's not to say we don't do other things at once, but it is so important. A lot of us start to look at other, focus on other objects right away. Like, for example, heavy metals, for example, gets a lot of attention, and these are areas that we do measure. But it's not a great strategy to start pulling heavy metals out until your gut lining is better, because that is all part of improving your detoxification pathways when your leaky gut has been healed and sealed.
Yeah, you're also talking about the gut is a place for the neurotransmitters. And I think one of the things we see many times with autoimmune disease, mentally can be challenging, because also when you receive a diagnosis, it can be depressing, it can create anxiety, it can create a lot of fear, it can create a lot of emotional upheaval, ups and downs because of the diagnosis, and also the limitations. Certain autoimmune can be really devastating in terms of limitations that can impose the person. So I think the gut would be a good place to have also this working well for the neurotransmitters, so the brain can also work better, or the mood, let's say, in this instead of the brain, like to have a little bit more serotonin, if I'm not wrong, is also produced right in the gut.
Definitely. And we have to remember, when somebody's going through, much like you alluded to, a diagnosis and just a sickness in general, it's often been very wearing, very grinding on them emotionally. And, for everybody, it's got its own unique set of stressors, but this can be a very trying time. And so anything that we can do just to help them start to feel better and reduce some of the stress hormones and support some of the healing and relaxing side of the biochemistry in our body is very important. It's very hard to heal when we're trapped in the fight or flight. This is, something known as the sympathetic dominant state. It's very hard to heal when you're in that state 24/7.
Yeah.
And some of us aren't even aware of that we're constantly perpetually into this, state of very pro-inflammatory, very pro cortisol driven. Now, cortisol is not the devil. It sometimes gets made out to be. It's important for a lot of good things, but in certain amounts. And the dose is the poison. That's a very important thing. But we also need to switch that over to the rest and digest. And if we're constantly flipped over in one side, we can't come back. We can't be having our feet in both sides. We have to be able to come out of that fight or flight and get into the rest and digest mode, which is where we heal. And this is why, again, things like sleep, for example, and mindfulness and taking time and to literally unplug and start to allow your body to start to heal. It's very hard to do that when you're flying from one meeting to the next, and you've got deadlines, and you're stuck in traffic, and you've got kids screaming, and you got home, and I'm just naming a million things. It could be anything. But these are things that we're caught up in it right now, and we have to sometimes really remember that it's coming back down to the basics too, to allow your body to just give it a chance to heal.
Yeah, I think that's very important, and it's important for people to be aware and conscious of that, to give a chance for the body to heal. I like that very much, because many times we do not even notice that we are super active, and as you're saying, doing this, or I have had a person very anxious, and then I'm talking to that person, and he was just saying, but everybody's like that. And I said, well, not everybody's like that, but even if everybody's like that, that's not the optimal thing, of the way of being for your not only mental state, but your physical emotion, but also physical state, because the body cannot really recover. And do you think the pandemic, this for the last 3 years, made it worse? Because there is a rise already in, I think from the last years, I don't know the numbers now, but there is a rise of autoimmune diseases already. But do you think because the pandemic definitely made everybody more anxious also? So what is your opinion about that?
Well, I think you're right. I think the stats are pretty clear on that we're seeing that collectively this has increased a lot of stress, whether it's financial, whether it's worried about their health, isolation, uncertainty about the world. Like there's so much there, and that's a whole nother conversation. But I have seen the impact. I have seen that physically impact and emotionally impact a lot of my patients, which we've been there to help guide them through as best as we can. But even in seeing some of the data, it's quite. It'll be interesting to see how this washes out over time, because as we know about COVID, there's also, many of us even, have been hit by COVID, and there's a whole sequela of an inflammatory response that we probably are still yet to fully understand how that might impact us. But nonetheless, it's not about fighting one particular virus. It's about supporting your own innate immune system and making your body as healthy as possible. So I look at this as a positive, meaning that this is a great time for us to take stock of our health and to set back and say, look, you know what, this is a big scare for a lot of people. But the best thing that we can all be doing, in my opinion, is to focus on where a significant part of our immune system resides, which, once again, not to sound redundant, but lies within our gut lining. But there's many factors beyond that you can do. You can change, you can vote with your fork, you can vote with your feet and get out and move again. And right, we can start taking time to really just unplug and spend time with our loved ones and our close family and friends, and really start to get that healing power back in stock. There's all these wonderful things with technology, but we can't forget that we need to sleep right, we need to eat right, we need to poop right, we need to drink right, and we need to de-stress right. And there's many other factors there, but those are some of the big things that all of us have the potential to do, and to take power back and be advocates for our health.
Yeah, and I think for the COVID also, even to socialize, we all need that. We all need some level of contact, flash, and really not only in Zoom. I stay a lot in Zoom because I work through the Zoom also. Like we are here, I'm glad you're in Canada, I'm in the United States, but we need this also contact with people. I think that's also very healing. Yeah.
And it's been really great to see, especially this past year, 2022, a lot of my patients have requested to come back in person, and we've been here with open arms and anxious to see everybody. So
that's wonderful. Thank you so much. Well, we are getting to the end of our session. I really appreciate your time, but I would like to talk about two things before we finish. And one is your gift. So for the audience, we have a gift from Dr. Dempster for you today, and it's a Wellness Without Limits ebook. So you have a button here below. So just click, wait a little bit to click, please, before we finish. And you can access the ebook, and you also have his social media and the homepage written below to contact more directly and deeply with Dr. Dempster. And I also have a question, which I like to finish the session, which is like any final word for someone who is suffering with autoimmune disease now.
Well, even just listening to our conversation, for some people, this can be very overwhelming. And we're trying to keep this as light as we can, but the real complexity of autoimmune is vast. And it's up to practitioners like myself to really try to make sure that we don't make this as overwhelming as possible to our patients and do things step by step. So the number one thing that I would say to end today is it's not about perfection. It's not about doing everything at once, taking it all on so it's like a tsunami of health information that it's overwhelming you. That itself can be very stressful. But it's not about perfection, it's about progress. And so do something, whether that's literally one small step better than what you did yesterday, because the compounding interest, if you will, of that is going to be profound. And if you do one thing better week by week, month by month, you are going to be significantly a different person in a year from now. Don't feel like you need to change this all in one day. I don't recommend that, nor do we advise that. But we do approach this and to make sure that we do it in a logical way that works for everybody. So it's okay to be somewhat intimidated or overwhelmed by all the different speakers on your summit, Roberta. But at the same time, you should be inspired and make sure that you are inspired to take action, because those who take action right now get rewarded, and that's really what it comes down to, is take some steps that you don't have to step all the way to Mount Everest on day one.
Oh, wonderful. This is great. Thank you so much. I love this advice. So do something, but you don't need to do all of it and everything at once. And perhaps, as we are talking even before about anxiety, or then feeling the sympathetic nervous system, that we are doing many things at once and the body goes into fight or flight. If a person tries to do all at once, it might go back to the sympathetic nervous system and to fight or flight and tension in the body, which is not good at all for your gut, well, health also. Not only the gut, the whole body, but especially the gut. So I love your advice of taking one step at a time and just something toward progress, toward feeling better, toward doing something that can change the overall picture of your health. And be patient. I think that's very good. And you said, step by step, you will get there. And I think that's very beautiful.